Alright, so we are going to be talking about dissociative anesthetics in this video. Phencyclidine and ketamine are the two ones that they have listed there, but there are a couple other ones that we'll talk about as we move through. The main one, and you guys should star this, is the ketamine. Please write down ketamine. It is the most commonly used dissociative anesthetic. Once again, ketamine is the only one used in veterinary medicine. It can be used alone. And generally speaking, we mix this with other drugs, but generally it can also be given in cats for just minor procedures. Once again, it is used with other drugs. Tranquilizers and opioids are commonly mixed with this drug. There is a medication combination that we use in veterinary medicine all the time called DKT. That's dexmedetomidine, ketamine, and torb, which torb is also known as butorphanol, and it's an opioid. So we have dexmedetomidine, which is a sedative or a tranquilizer, mixed with an opiate, mixed with a dissociative, and we call this drug nicknamed Kitty Magic, and it is a very commonly mixed anesthetic. It can be used as a sub-anesthetic dose for pain. It works on the central nervous system for pain, so it can be given as a constant rate infusion for analgesia. And this is micro-dosing this drug whenever it's given this way. Thalidomide is the other one that's commonly used. It is combined with the benzodiazepam zolpidem, and thalidomide and zolpidem, that is thalidomide and zolpidem, get mixed together by the manufacturer in a combined form called Tilazol. It can be given IM or IV to produce sedation and anesthesia. It can be used alone or in combination with other drugs. It is a very, very common anesthetic induction agent in veterinary medicine. It is considered a Class 3 controlled substance, so it doesn't have the same classing as some of our most powerful opioids, but it's pretty darn close as far as the DEA is concerned. So how dissociative anesthetics work, and this is ketamine and thalidomide and tilazol. They disrupt the nervous system transmission in certain brain sections, i.e. the brain cannot communicate with the nervous system, okay? It has selective stimulation on parts of the brain and decreases wind-up through NMDA inhibition, which is just another inhibition of another receptor within the brain. It is said to produce a trance-like state. Animals appear awake and immobile and unaware of their surroundings. And people's studies have been made with this drug over a period of time, and people usually don't remember anything that happened while on this medication, and certain people that use this drug and street drugs will say that it's like they're floating above themselves whenever they take this drug. So it can be a pretty crazy drug. And there's a cat on ketamine. You can see that its eyes are wide open. Also, please take note that the muscles do look rigid in that picture. That is a very, very common thing when it comes to ketamine. If it's given alone, the muscles become very rigid. So ketamine, the peak action is 1 to 2 minutes after IV injection. It works pretty quick. And then 10 minutes after IM injection. The duration of effect is about 20 to 30 minutes, but if we give a little bit more, it can prolong the duration, but does not increase the anesthetic effect. This is another drug that has that ceiling effect, which means the drug can only produce its effect to a certain point and no more. All dissociatives are either metabolized by the liver or excreted unchanged in the urine. So this is a drug that is metabolized heavily in the liver, and we avoid use in the animal with liver or kidney disease because of this. they become in a cataploid state, which is essentially, once again, think of that cat a couple pictures back. You can go back and rewind this and look at that cat. That is a cataploid state. There's only a few intact reflexes at this point in time. Palpebral, which is hitting the the inner eyelid and watching for blink. Corneal reflex, pedal reflex, which is squeezing the toe to see if the animal will pull back, pupillary light reflex, laryngeal reflex, and swallowing reflex. So they can still swallow while on this medication alone. Eyes do remain open. Once again, go back and look at that cat. The eyes are usually very dilated, the pupils are, and we must use ophthalmic ointment with this drug, but any anesthetic agent should have, any anesthetic agent patient should have eye ointment provided to them. Muscle tone, remember that cat. If it's just this drug, we get muscle rigidity. That's why they combine this with other drugs to counteract the concurrent tranquilizers. So generally speaking, remember teletamine is mixed with zolpidem, teletamine and zolpidem to make tilazol, so that tranquilizer helps with the muscle relaxation and knocks that away, and the animal is still under the effect of the ketamine at the same time. They will mix Valium, which is diazepam. Please refer to the benzodiazepam conversation video, with ketamine, so they call it a ket-val injection. That's the nickname for it in veterinary medicine, where they mix ketamine with Valium together, and that gets rid of that muscle rigidity also. Analgesia, somatic analgesia, this is muscles and things like that. Visceral analgesia, this is organ pain, and so it does have some analgesic effects on both somatic and visceral systems. As I stated before, in humans, people have amnesia. They can't remember exactly what happened while they were on this medication. Our animals can have sensitivity to sensory stimuli. This means that they can be wound up after when they start to wake up by noises or even lights. Sometimes it's recommended that these animals are to be woken up in a dark room or covering the front of their cages. That way they can't see or hear a lot of the stimuli that may be happening around them. And some strange and bizarre behavior can be seen with this drug. They will swing their heads violently at times, or just walk and try to push their nose through the front of the cage. This is cats and dogs. It's a strange thing, but we do need to worry about that. In dogs, certain dogs will actually try to chew through the cage, but that is very, very rare. And it may produce nystagmus. And nystagmus is movement of the eyes back and forth, right? That is nystagmus, and is absolutely more common in cats. They have a stimulation of the SNS, which is sympathetic nervous system, and because of the sympathetic nervous system, i.e. the fight or flight, we can have an increase in heart rate, cardiac output, and mean blood pressure, which normally in an anesthetic event, all these things aren't too bad. But the biggest thing is if they are a cardiac patient already, this drug has to be given with some concern on the heart, because it may decrease ionotrophy, and that essentially means that the heart will not be able to pump as hard, even though the heart rate is faster and the mean arterial pressure is good. It causes some issues with that. So we always screen patients for heart disease beforehand. I've never seen this drug given to an animal that has a heart murmur. And the other thing that it can happen is it can have an effect and cause cardiac arrhythmias, which is an abnormal rhythm within the heart. Respiratory and tidal volumes may change. And the respiratory depression is usually insignificant. the animal can develop what's called an apneistic respiration at higher doses, and essentially what this means is they hold their breath. So they'll take a breath and they'll hold that breath at the top of the respiration. It's almost like they forget to breathe out. That's the best way I can describe it. And if this animal gets severe overdoses, if this animal gets an overdose, it can cause severe respiratory depression or even arrest. And another side effect is, generally speaking, your animal will start to drool heavily, i.e. hypersalivate. One of the things that I think that we probably need to touch on, and it's on the top of this page here, is transitory pain after IM injection. When we give this into the muscle, it stings, and the animal lets you know it. A cat will go kind of haywire at times when given IM, so you have to have proper restraint when this drug is given. You should never try to give this drug without somebody properly restraining the animal, because it stings when it's given. This drug is not given in any animal that has head trauma, because it can increase the intracranial and intraocular pressure. And so any head trauma or cerebral spinal fluid pressure, and even some ocular surgeries. And in fact, generally speaking, ophthalmologists in veterinary medicine do not ever use this drug. Can be given IM or IV. It has a very wide margin of safety. It's useful in cats and horses, but I will say with horses, it's one of those things that it's dose dependent on if it's useful. It's used in combination with tranquilizers, i.e. ketamine is mixed with Valium. It's the only drug that Valium is ever mixed with. Please refer back to the benzodiazepam conversation before. It's usually used in short procedures, in anesthetic induction for intubation, and chemical restraint in cats. This is a very, very common one. So if we have a fractious cat that needs to be groomed or something along the lines of that, this drug is a go-to for a lot of veterinarians. It can immobilize large and exotic animals. You guys have probably seen dart guns in veterinary and wild animal shows whenever they sedate. Most of the time it has a ketamine type drug inside them. And once again, in micro doses, they can also be used in pain control. The biggest thing with this drug, as far as an overdose goes, is there is no effective reversal agent. Once the drug is in the system, it's in the system. There's no taking it back. Ketamine is most commonly used in the U.S. in small practice. It is licensed for use in cats and subhuman primates. It can be used to anesthetize just about everything, though. It is very, very common on just about every species out there. It is a Schedule III, so it is a controlled substance. It has a very rapid onset of action, and can be given usually IV or IM. It is not, or even orally in cats, which means if you have a kissing cat in the cage, you can actually squirt this into their mouth and they will become sedated by it, which is really, really nice. IV advantages are more rapid induction and recovery. Usually you have to give a lower dose, and it's only to be given IV in dogs. You never give this drug IV in cats. Repeated dosages you have to use with caution due to the respiratory effects. Full recovery is 2 to 6 hours, and that's a wide range there. You can have some animals that bounce back pretty quick, closer to the 2-hour range, and you can have some that it can take 6 hours on. There's our elimination renal and liver system, and once again, it's also often used in combination with other tranquilizers. All right, this concludes the first part on dissociative agents. There will be another video, part 2, to conclude this conversation.